student along with Dr. Anna Burnalari. We were listened from Dr. Morgan. He is from Wisconsin University. He was taught about family nurse practitioner. We realized that why India is not able to start this type of practitioner at Indian level. And we were thinking that time, we were student that time. We were not understand that why we are not able to start. But still, 22 years over, I'm working at a national level institution. Still, we are still behind that. And even we are celebrating 75th Independence Day. But nurses still visible in India. We are doing a lot of contributions. Even Indian government realized that nurses need to be practiced independently. That makes a lot of improvement in the patient care outcome. But still, what is the lack? What is the gap? We want to have the thought in your mind, the thought, what we are at the eminent people like Dr. Nalini, who are there in the institution, many students who are passed out, who are working at practice at in other countries, then she can express in that way. And like Madam Radhi Balachandran, who is trying out a lot for that, to bring the policy, to implement the policy, to make us practice independently. So these people, eminent people, can bring out that the views along with the input from that external speaker, that from other country, Dr. Annapurna, Dr. Annachar, they can bring the thought, they can give the input that what they are doing, that really is going to help us to bring out a change in India in the future. That's the reason we are starting. This is not the only webinar to hear, bring some input or thought in your mind to bring our vision that create the policy, to implement the policy in the future to nurse to be independent. This is the way we want to forward. I hope that that definitely going to be a very fruitful program for everyone. It's all the best for everyone. Thank you very much, Dainy. Over to Dainy.
Thank you, sir, for your visionary words, and we are always empowered by you. And you are an exemplary leader for us. And now on, I'll hand over the mic to Jyotishana to carry forward.
Thank you, ma'am. Now, I'd like to welcome Dr. Farooq Khan to introduce Award Nurses Teacher Association of India. And sir is working as a principal at Academy of Nursing Science and Hospital Gwalior from Madhya Pradesh. And sir is also a national president of Nurses Teacher Association of India. Over to you, sir.
Thank you, Josna ma'am, for nice introduction. And first of all, I would like to thank Almighty God, because He only has given an opportunity that we have make association with the Society of Cardiac Nurses. And I would like to thank to Gopi Chandan sir, because sir has given an opportunity for the association with the Delhi TNA branch and now the Society of Cardiac Nurses. And all the members of the Nursing Teacher Association are very happy with this association, because we are with this coordination, and we are working with each other. And I would like to thank today's eminent speakers, Dr. Anna George ma'am from US, and from Sj Nalini ma'am, Dr. Rathi Balachandran ma'am, Dr. Annapurna Mary ma'am, and other members from the Society of Cardiac Nurses, the President sir, Mr. Neeraj Kumar sir, Dainy ma'am, and the collaboration which has been given with the effectiveness by the CBS publication. I would like to thank Bhupesh Arora sir. So we will come to the Nursing Teacher Association. The Nursing Teacher Association has been founded in January 2019 with the aim to upliftment of the nursing fraternity, because the nursing teacher was seeking that one of the platform must be there so that the teachers will get some optimum knowledge and how to updating the knowledge. So like these sources, we have created this, we have organized this Nursing Teacher Association. And at present, within these 2 years, at present, we are having more than 3,000 members working and joined in our association, not only from our country, but also from abroad, from Canada, Australia, Ireland. They are also joining us and they are supporting our Nursing Teacher Association. And recently we have arranged the blood donation camp. And in COVID time also, we have distributed the mask, and we have made it the camp health centers also. So because of our nursing service and our nursing service coordination, only we are able to do the working. So thanks to all, because I will not take the more time to tell about the association. So proceed today we will proceed this webinar first of all. And once again, I would like to thanks to all for this coordination of this webinar. Thank you so much.
Thank you, sir. Thank you so much, sir, for the brief introduction about NTA. Now, I'd like to welcome Professor A. Maria, President of Nursing Teacher Association from Pondicherry. Over to you, ma'am.
Good evening, friends. I call him free, who with his concise, awake realizes his rights and responsibility and duties. Freedom of mind is the real freedom. With a beautiful quote of Dr. Ambedkar, first of all, I wish you all a happy 75th Independence Day. I'm extremely overwhelmed to get this opportunity to introduce Chief Guest and Guest of Honor to this first webinar on Advanced Nurse Practitioner, Paving the Way in India. Now, I'm profoundly delighted to introduce the Guest of Honor, a person with positivity, strength and pride to our nursing profession, full of enthusiasm in all her endeavors, a trendsetter. More than that, a good human being is none other than our Dr. Radhi Balachandran, Assistant Director, Director General, Ministry of Health and Family Welfare, Government of India. She is very well known and one of the most distinguished person. Yet, the occasion demands, and here it is in brief. Dr. Radhi is an educational repository. In addition to that, to her PhD, she had undergone different courses like Policy Program 2018 from Global Nursing Leadership Institute, International Council of Nursing, and she has obtained PG certificate courses in diabetic education, health and family welfare management, and completed MBA in HRD2. She has carried out many nursing scientific studies and organized different clinical workshops exclusively for our nursing personnel in India. Madam has visited several countries like Singapore, Switzerland to participate Global Nursing Leadership Institute residential program and Jordan third country training program course on nursing pedagogy. Madam, we are delighted to have you here. Definitely, it would be really a remarkable one of this day. Over to you, ma'am. Waiting to listen to you.
Good afternoon, Dr. Gobi Chandra, Mr. Neeraj Kumar, Dr. Farah Khan, Dr. Maria, and the various dignitaries, Dr. and all the other dignitaries. First of all, as we are celebrating 75th Independence Day, a great Independence Day to one and all. And I also express the appreciation to the team for organizing such wonderful webinars and associations connecting with each other. As today's theme is Advanced Practitioner Paving the Way in India. As we all know, we have even started nurse practitioner in critical care, nurse practitioner in midwifery, and also we have community health officers who function just like a family health physician in the rural areas for every 5,000 population. So because of progress in the nursing profession, we have diverse type of courses, and there are various opportunities for us to update our competency, be it in the theory as well as in the clinical competencies. We all are passing through a hard time of COVID-19, which has given a significant impact on the health of individual in all aspects, that is physical, mental, social, as well as spiritual well-being of the persons are affected. And the community is also affected. And first wave, second wave, and we are expecting a third wave also to come. As healthcare professionals who are more focusing on health promotion and prevention of illness, it's our duty to protect our people from this communicable contagious disease or deadly disease, which if we are taken care properly, it will leave, we can succeed the disease, but it is also taking life of very young people. So my tribute to all the nurses and other healthcare corona warriors who have given their ultimate sacrifice in doing this mission of protecting our fellow beings. So this corona has also given us a lesson that what all things we have learned are all changed. Now corona is a new disease which has made us to think how this is spreading, how we have conducted research to identify what is the natural history of the disease or the stages of disease, how it is spreading, what is the pathophysiology, what changes it is taking, how we can protect the people or how we can prevent this disease. So all these things are new, and we all become vigilant and observe. That shows that as healthcare professionals, it's important for us to update, and continuous learning is important. And I appreciate this society and this organization to organize webinars in order to update the competency of nurses. As I mentioned, the critical care nursing nurse practitioner is the latest one which has started in our country. And before that, we had nurse practitioner midwifery. So these things we are trying to have more clinically competent people. Then there is a question, what about those masters? Are they not an advanced practitioner? Yes, an advanced practitioner requires both the theoretical knowledge as well as clinical competencies. So somewhere our previous master courses were having more of theory, and the new thing is having more of clinical. So it's very, very important to have knowledge. Without knowledge, if we are practicing or if we are doing the procedure, that means just like a blind man walking. We don't know which direction to go, where to go, how to go, but we are walking. But if we have a knowledge and if we are not putting into practice, that's also waste. Ultimately, nursing is a clinical oriented profession to protect the people's life from illness as well as sufferings. So the efforts that associations are doing, or the government is also trying to bring the clinical as well as theoretical knowledge together to create a level of nurses or a level of healthcare professionals who will be able to protect the people and reach to the reach across the country, whether it is urban area or rural area. It's highly required, and it is our responsibility to shoulder this responsibility of universal health coverage and sustainable development goal. I congratulate these organizers for this, and I appreciate the participants for sparing the time to understand, to connect together and learn from each other, sparing your time in this day of celebration of independence. Also, you are connected together to discuss about the critical care needs of the people and what is how it is practicing, and what is the challenges what we are having and how we can take it ahead. Ministry of Health is very well aware about the importance of nurses' contribution in the healthcare, but the success will be only if we are working together. We have started few training programs The nurse practitioner critical care are daily training the people. There is a 14 days training program from Monday to Sunday, 2 days, 2 hours every day for discussing about the critical care management of COVID-19 patients. So such small initiatives we are trying to do. But as I mentioned, the competent people has to come forward and deliver their competency or competent care to the people in preventing these diseases and helping them to enjoy the total well-being, that is physical, mental, social, and spiritual well-being. So we know that the demographic changes are happening there, pathophysiology, epidemiological transitions are happening. More and more old age people are there, and the non-communicable disease are also increasing. Life expectancy is improving, and the cost of healthcare is rising too much. So to me, the critical care competent nurses are not only required in the hospitals, they are also required in the periphery, even at the subcenters, so that we can prevent the complications and prevent these diseases. And we can even help the people to manage it in their family and community, so that the cost of healthcare cannot be a burden for them. So I wish this webinar a great success, and I also request all the organizers to to make such great efforts, so that continuously we will be able to update our knowledge, and we will be able to contribute effectively in the healthcare delivery, and our contributions can be visible in the name of nursing profession's contribution. So wish you a great success. Thank you very much for giving me an opportunity to be as part of this initiative. Thank you. Over to you, Dr. Maria.
Thank you, madam, for your wonderful words, which enlighten us how the nurse to be competent in all the aspect, especially in the clinical aspect. Thank you, ma'am. Again, I'm happy to introduce a charming and dedicated person, Dr. Annapurna. She is a profound woman because, despite of the hardship, she managed to finish and pursued her studies from a diploma to doctorate in nursing. Next slide, please. Next slide. Next slide. Okay. Being an Indian nurse, she is spreading her professional fragrance across the world successfully. It's really a honor to all of us, all of the nursing fraternity in India. Presently, she is serving as Director of PhD Program, Lowenberg College of Nursing, the University of Memphis. Dr. Mary received a Doctor of Philosophy in Nursing from the University of Dainy in the year of 2007, a Master of Science in Nursing from Sj Ramachandra Medical College and Research Institute in the year 2002, a Bachelor of Nursing from Madras Medical College, and Diploma in General Nursing and Certification in Midwifery from St Anne's School of Nursing. She specialized in medical surgical nursing and critical care as a subclinical specialty. Dr. Mary teaches evidence-based practices in baccalaureate program as well as PG program. Advanced Nursing Research Program for MSc she has been teaching, and clinical pathophysiology and introduction to professional nursing also she's been teaching. Her online teaching courses includes advanced nursing research and evidence-based practice, through which many of the nursing people have benefited a lot. Dr. Mary's service to Lowenberg College of Nursing includes co-chair of the Students' Affairs Committee, undergraduate curriculum committee member, and graduate council member, nurse researcher council member for Baptist Memorial Healthcare. Dr. Mary practices in critical care and emergency room and MRT. Her research interests are critical care, medical surgical nursing, cardiac nursing, nursing education, especially in critical thinking and clinical reasoning. In addition to this, to her credential, Madam has lot many of scientific research publication. Dr. Mary, we are extremely looking forward to listen to you. Now the forum is yours.
Thank you. I appreciate your introduction.
Thank you.
Good afternoon to one and all, to the dignitaries, organizers of this esteemed society. It is really a visionary function which is beginning today. Dr. Kobe, myself, and we were part of this discussion many years ago that we should create with Professor PBR and with the international professors from Wisconsin. We were discussing and debating how we could make it possible to bring advanced nurse practice to India, especially family nurse practice to India. Then in 2015, I represented our college in a MOU committee to Nagpur University, Gujarat. I was a core person in the discussion of beginning to discuss about developing curriculum for the nurse practitioner role in India in Gujarat Nursing Council. When we were discussing many things, many opportunities, and many avenues, how we can begin this. We also took notice of many barriers present in our current nursing situation, along with the healthcare fraternities in India. So the discussion became so vibrant, and myself and some more professors, we went to Gujarat. We traveled from United States to Gujarat, and I was honored to be in that team. And we had a seminar conferences over 3 days on this topic, and it brought forth a lot of discussion. And now, when I was invited for this, I searched the Indian Nursing Council, International Nursing Council. I was so excited to see that we have already an advanced practice nurse program approved by Indian Council of Nursing, and the educational track has been developed and approved, and the program guidelines are published within Indian Nursing Council. I was so excited to see that. So we are not starting from a scratch right now. We are in the progressive aspect or journey in this process of establishing advanced nurse practice curriculum, legislation, and practice itself in India. We are in the beginning of the process. So as I said, I was so happy to hear that we do have a curriculum already in our system. I would like to take a quote from Prime Minister Narendra Modi, which is very applicable to the current status of advanced practice nurse role in India. He said, We live in an independent world, but India has no purpose of staying isolated from the world. This is a very profound quote we can apply to this situation. We live in an independent world. However, it is time for us to take inventory on our nursing practice, nursing education. Are we in par with the world nursing? Are we in standard and comparability to the international nursing standards? Further, advanced nurse practice, I am to open the theme. So let me open advanced nurse practice, what it is, and what are the three pillars of developing as advanced nurse practitioner role in any place, especially in India. What is advanced nurse practice? Advanced nurse practice includes nurse practitioners, clinical nurse specialists, nurse anesthetists, and nurse midwives, and many are evolving right now. All play a pivotal role in future of healthcare. Advanced nurse practice is so significant that it is essential for improving, promoting health equity, health for all. We live in an independent nation. We do have a very good healthcare system, primary, secondary, and tertiary healthcare system, which begins from the rural area and it covers the urban area and it penetrates all over India. In a nook and corner, we have a system, which is a great system. Many nations are studying our nation's healthcare system. Especially our primary healthcare system is salutable. In that situation, what is the current status? 72% of the people live in a rural area. But 75% of the healthcare has been provided in the urban area. This is called inequity. Inequity of healthcare. Most people live in the rural area, but majority of the sophisticated healthcare is provided within urban area. This is a real example of health inequity. Now, we nurses have a great opportunity to fill this gap. If we take nursing ratio to physician, we are the best exporters of nurses to all over the world. Congratulations to us. And I am an expert too. Therefore, our nurse-physician ratio is low in India currently. So we are in a position to take the existing nursing roles to a predominantly health equity levels of roles. And we have a great opportunity to fill the gap in the healthcare system I just now exposed. There is a health inequity between the urban and rural distribution of healthcare. So when I have said this, let me say one more thing. We are not, nurse practitioner role is not something imported. In our healthcare setting, in our healthcare nursing education, we had nurse midwifery certification always was having a license to hold, conduct delivery was given to us in our nursing education. So we are not very far from, or we are not reinventing the wheels. We are not creating something new. Our curriculum has it. Only thing what we have to do is taking the existing curriculum and boost it, standardized it, accreditate it, legislate it to bring forth to the advanced practice level. So it is not hard. I would like to say here, when I open the theme, it is not hard and we are not reinventing the wheel. We already have a prototype for the Advanced Nurse Practitioner for Critical Care Nurses in India, which is the beacon for us to follow. Already a prototype is there. So it is easy for us to develop all other specialities of nurse practitioner roles in India. So while developing that, we have to pay attention to 3 areas. Number 1, education. Education involves curriculum development, curriculum evaluation, curriculum standardization, curriculum accreditation. Next level is practice. Practice is in United States currently, as we speak, a major overhaul has been done for nursing essentials. I am here to inform you that United States nursing curriculum is under revision currently right now, and every universities and colleges, we are revising our curriculum based on new essentials. I think after 1950, this is the best revision we had in nursing curriculum, which will transform global nursing. So in that, the main thing is competency-based nursing curriculum. So we really need to develop advanced nurse practitioner role to the competency-based matched curriculum, which is the newest curriculum. That's number 1. Number 2, practice should be based on competency-based evaluation, specialty-based education, and translation of the education to the practice with the evidence-based practice and advanced practice nursing. And 3, the major portion, the barrier we will come across is that practice legislation. But we will get there. It is not easy in the United States as well. Every state has its own variations in providing autonomy for nurse practitioners. Some states allow them to practice. Some states provide them protocol. Some states tell them, you practice under policy, under the physician. So this is common globally. Even legislation to prescribe, legislation to diagnose, legislation to hold a title, legislation for compensation, all this needs to be as a third wheel and an important wheel of developing advanced practice role. Having said all that, while developing in the beginning itself, the advanced practice nurse role should be evidence-based, under evidence-based practice, research-based, evidence-based, competency-based. Curriculum should be developed. The curriculum should be rigorous for the accreditation, and therefore we can demonstrate ourselves and our role in we can begin from rural area. As ma'am said, critical care nurses are not just needed in urban area, not just needed in tertiary hospitals, but they are needed even in the primary healthcare setting and in the village area. I will tell you a story and conclude my theme, unlocking. I am from a rural community near Tuticorin in India, very rural area. I was just a general nurse then. I had diploma in nursing and I had certification in midwifery. Rural village, those days we didn't even have frequent buses to that village. A call came to me in the night. I was visiting my mom for the holidays. At that time, I was running a clinic for a mission hospital, time clinic, and night times, usually evening to nights, we had deliveries, lot of deliveries, 1 to 3 near Rameswaram. Those days, we didn't have bus there. There was only a train. If we have to do references, we have to do a day or 2 days before, anticipate and do the references. Our clinic was overseen by a physician. He will come time to time and oversee our activities. I was in charge of the clinic. And we had, by policy, we had prescription authority. We had authority to conduct the delivery. So when we were doing that, in the rural area, that's why we were given that authority to conduct the delivery. As I said, there is a gap, there is an inequity, there is a place we nurses can fill in authoritatively. We can really educate ourselves and standardize our practice, legislate our advanced nurse practice, and there is a huge opportunity in India to fill the gap in the rural and in the urban area gradually. And for this, we need to collaborate with our healthcare partners, stakeholders, and government. And I am sure our government is very open-minded for healthcare. And we have done phenomenal work, our government, under the leadership of Prime Minister Narendra Modi. Our healthcare has done a phenomenal work, which is spoken globally to the extent. And when we were in need, the help were just flowing spontaneously, and India took leadership in COVID control. And we have to salute that, and we have a huge opportunity, and it is the opportune moment. With this, council dignitaries, members, colleges, universities, and nursing council, and the accreditation body, I congratulate every one of them for this Himalayan achievement of Paving Foundation for Advanced Nursing Practice role in India. Congratulations.
Thank you so much, Dr. Mary, for your thought-provoking talk. It really made us to sensitize the message. Even it could be taken it as a take-home message. Through education, we can obtain experience or practice to become expertise, for which we need a dedication, interest for the transformation. Thank you. Over to Dainy.
Thank you, Mariama. Next, I would like to welcome Jyotishana, the Joint Secretary of Society of Cardiac Nurses, to introduce the speakers of the day.
Am I audible?
Yes, Jyotishana.
Thank you, ma'am. Now, without wasting much time, let's move to the today's webinar. So, I feel honored to invite our first eminent speaker from international level, that is Dr. Anna George. She is a family nurse practitioner currently working as an assistant professor from Molay College, Rockville. Ma'am is the president of Indian Nurses Association of New York and Advanced Nurse Practice Nurse Chair for National Association of Indian Nurses of America. Also, ma'am honored by a Patient Focus Award by a Northville in 2018. Ma'am is instrumental in organizing and various numerous community activities and charity works, along with conducting various educational webinars. And ma'am will be talking about advanced nurse from internet.
Hello.
I think she has lost the internet connectivity. I would like to welcome Dr. Sj Nalini for the first talk.
I thought I was. Hello.
I think Dr. Anna will do this because she had to leave early. She just made a request. Can I request Dr. Anna to take charge now? Thank you.
Hello, everyone. Good evening to all of you, and wish all of you a very happy Independence Day. This is a proud moment for us as we celebrate our 75th Independence Day. Congratulations to everyone and happy Independence Day. So yes, like Krishna was trying to say, I am a nurse practitioner for many, many years and currently teach in the Family Nurse Practitioner Program at Molloy College. And I am so happy to hear that not only India is trying to increase its level of nurse practitioner programs, but already that there are programs that are implemented. So what we, like Dr. Annapurna Mary has been elaborating, that it is not something that we have to reinvent the wheel, but something that we can build upon on what we have. And the health care, which is so well settled and elaborated in our country, in India, can only be elaborated by looking at the international levels and implement it in India. So I know Dr. Annapurna touched on how that can be done. I am going to share my slide and show you what kind of nurse practitioner programs and curriculums exist in United States. So something that can be modeled or used as India tries to pave its way to have more and more nurse practitioners in all their states so as to meet the needs of the population in India and to provide healthcare not only to those in the urban areas, but also to reach the rural areas who can really use the nurse practitioner on different levels. So give me a minute as I try to share my screen. I'm hoping I am audible and you can see my screen. So again, happy Independence Day. As I said, I'm very proud, even in United States, in New York here, we celebrate it very enthusiastically. We are having different parades organized in different parts of United States today. So we are very happy for this beautiful day that we are celebrating. Nurse practitioner programs in USA, paving the way in India, such a beautiful title. We can never forget our leader, Florence Nightingale, who is our leader and the founder of nursing. So we need to take, I salute her for all that we are today, and as we advance our career to be nurses. So we already know who is a nurse practitioner because I see that you have already have the acute program in India. So NP program has become very popular in United States as it is a program that has paved the way to bridge the gap that exists. NPs, who is an NP? She's a clinician that blends her clinical expertise in not only diagnosing, but treating the health condition with an emphasis on disease prevention. And that is why the NP program is flourishing in United States, because the NPs, they put their emphasis on disease prevention and health management. NPs usually bring a comprehensive perspective and a personal touch to healthcare. We nurses are caring, as you all know. So nursing, and when they become nurse practitioners, they bring that caring touch, and which has made them very popular in United States. So what is a qualification of an NP? As you already know, NPs undergo a rigorous program. The full-time NP program in United States can be completed in 2.5 to 3 years, but most of the nurse practitioner programs, nurses study as part-time because they are all nurses. So they have full-time job and they do the NP program, which probably would take them about 3.5 to 4 years. They undergo a vigorous education and training. And after they graduate from the NP program, they have to undergo a national certification to practice. And this is in most of the states in United States. And this national certification has to be renewed every 5 years, which helps them to make their education current and to undergo continuing education. So there is periodic peer reviews, clinical outcome evaluation, for which they also have to adhere to the code of ethical practices at their given facilities. NPs are required to maintain the certification through professional development, either through continuing education, or they can sit for the board exams again, which nobody tries to do. They try to make their education and their clinical experience current by continuing education. So NPs lead and they participate in both professional and lay healthcare forums, which Indian Nurses of New York and many other associations are in the front line. They conduct research and apply findings to their clinical practice. So NP license. NPs are licensed in almost all states in USA, and they have to be licensed to practice. NPs practice under the rules and regulations of the state in which they are licensed. They are known for providing high quality care, not only in the urban and acute setting, but also in rural setting and suburban communities. NP practices, they practice in clinics. I practice in a clinic myself. I usually say about 10 to 20 patients on once a day a week. As you know, I am a professor working at Molloy College, but I like to practice in this clinic so as to keep my clinical experience current. So NPs you can find in United States in almost all the settings, in the hospitals, emergency room, urgent care, private physician offices. So it is, and not only that, they work in home care, schools, colleges. That's not one field in healthcare that you will not find an NP that is flourishing. NP program has really taken its search all over United States. NPs provide a full range of practice from primary, acute, and all the specialties in healthcare. They're able to order prescriptions. They're able to perform and integrate and interpret diagnostic tests of all kinds of X-rays and all kinds of interventional radiology studies. They diagnose and treat acute and chronic conditions from basically diabetes, high blood pressure to any kind of acute diseases. The most critical of which I think we should try to imitate in India is prescribing privileges that NPs have, prescribing medications and also other treatments. in a nutshell, they are able to manage their patient overall, and they provide education and counseling. Educating patients on disease prevention, positive health, and lifestyle choices is the centerpiece of NP education, which have made them, actually, I want to say, famous and growing in numbers. So who do they serve? I already touched this. They serve in every part of healthcare in United States. So they serve in acute care, adult. I am a family nurse practitioner myself, and there is gerontology, neonatology, oncology, you name it. They have put their hands on it. They are in all kinds of subspecialty. I have many friends who practice in endocrinology and have marked their people would I know patients who would rather tell you today that I would see a nurse practitioner rather than a physician. The reason being, the nurse practitioner takes more time with their patient. She would explain the consequences of the disease process. She will help in educating the patient about how to treat the disease so as to prevent further complications. And she provides more time, which in a way physicians do not have the time. So nurse practitioner program has becoming very popular in United States. And I want to emphasize that once it starts in India, this would be the best thing for all the rural communities and also in urban settings. So why are NPs becoming popular? Because of the emphasis, like I said, in health and well-being. They concentrate on promotion, disease prevention, health education, and counseling. So when this NP program starts in India, I want to emphasize this is what the NP program should emphasize on. NPs are able to guide in making smarter health choices and life decisions, which in turn will lower the patient's out-of-pocket cost. And that is why this has become more popular in many countries internationally. Going to the next slide. NP favorite healthcare providers. I can't emphasize enough on, I guess, being a nurse practitioner myself. This is a favorite role. Providers, they are also mentors for their population. They're educators that not only teach their patient, but their families and whoever else. They are also, and nurse practitioners not only work as nurse practitioners, but they work as clinicians, they work as faculty, they also are researchers, and they take many administrative role in many hospital settings. NP program is able to lower the healthcare cost. So that is something proven in United States, and I'm sure that NP program, when they start to flourish in India, it will be able to provide high quality care and counseling, and also you will be able to lower the healthcare cost in India. Another important aspect of NP program or nurse practitioner that should be stressed is patient satisfaction. So with more than 1 billion visits made each year to NPs, patients report that they're extremely happy with the kind of care they're getting from nurse practitioner. And many of them have also suggested it's much more superior to that of the physicians. Primary care shortage, and I know this exists in India also. By offering high quality, cost-effective, patient-centered health care, NPs are able to provide solutions for primary care shortages in America. And can you imagine what it can do in India, where there is shortages of physicians, and those physicians who mainly concentrate in the urban communities. So the NP programs will really be able to flourish and bloom and meet with the needs of healthcare of patients in India. Nurse practitioners for nurses is a gratifying role. And that is why it has been steadily increasing in United States, but But let me tell you, once it takes its foot in India, it is going to flourish there also. So as you see, United States Bureau of Labor and Statistics predicts that the need for NPs will increase about 36% from 2016 to 2026. So we are seeing going to be a surge of NPs there. And you will do the same when you try to implement the high quality care that the nurse practitioners are able to provide in India. For this, the nurse practitioners should be allowed to practice to the full extent of the education and training. Nurses must see themselves as leaders, as many of us already do. They have to have the higher education to lead, and they should emerge from bedside to the boardrooms, as I see that many of you leaders are already doing. For this, many of you are already leaders there who need to pave the way for all the nurses to practice to the fullest credential. Although 13% of nurses hold a graduate degree, less than 1% of nurses have doctoral degrees. This is here also a problem. And this should be rectified in India also. Nurse practitioners, going to the next slide, sorry. I'm going to give you a brief overview of the nurse practitioner programs in USA. You will see here that the advanced practice nurses practice as nurse anesthetists in nurse anesthesia program. They take the role of anesthesiologists that probably, I'm not sure if you have that in India, but they have been in so many ORs, in so many hospitals in the United States. Instead of having anesthesiologists, they have CRNAs, which is certified nurse anesthetists, which do the role of anesthesia. Along with that, the nurse practitioner program has taken so many different levels. So you can practice in the interest that you have. You can become an adult nurse practitioner. Adult nurse practitioner can be an acute nurse practitioner working at acute setting in the hospital or outside. Family nurse practitioner, psych nurse practitioner, which has been blooming to meet the demands of the psychiatric nursing. Then you have pediatric acute nurse practitioner working in the hospital, and you have pediatric primary nurse practitioner that works in the clinic reality of neonatal nurse practitioner. And I know there are many friends of mine who work as neonatal nurse practitioner in neonatal ICUs. We have adult nurse practitioner, but now we have the dual degree programs also, where you can graduate as an adult gerontological nurse practitioner and a family nurse practitioner as a dual degree. So is there another dual degree where you can hold the psych nurse practitioner and also a family nurse practitioner together, so they can take a comprehensive role and meet the comprehensive needs of their patients. I'm just going to show you, and this does differ from colleges to colleges. This is what we do in Malloy College. I am teaching in the family nurse practitioner program. So I am just going to show you the core courses that involves in the nurse practitioner program. So before they go to the specialty courses, they have a core course, which is about 19 credits. To become a family nurse practitioner, it's about 48 credits. So the core courses includes advanced medical ethics. We learn about advanced nursing theory and the theorist. We learn about the current issues of professional nursing, organizational theory in nursing, and to also have the advanced degree, they have to learn statistical analysis, and they will have to undergo a research method and design program, which is a 4-credit, very intensive course that many students really like. So after they finish the core programs, they go to an advanced practice core, which is about 11 credits. In this, and each, they have to finish the primary core to go to the advanced core. So once you're in the advanced core, you learn about advanced pathophysiology, you learn advanced physical assessment, which will help you to learn to diagnose diseases through the physical examination findings that exist. You also learn about pharmacotherapeutics and the pharmacological drugs in an advanced way. And also in this core practice, they learn about role of NP and how it transformed from nursing to an advanced role. So once they have finished their core, they go to what is called at the core of the family nurse practitioner program. In this program, which is about 18 credits, it involves 690 clinical hours. In the 690 clinical hours, which is divided into semesters, they either practice with a nurse practitioner or a physician for about 200 hours each, and they learn about how to diagnose, how to treat, how about education with the help of a mentor. While they're going to the clinicals with their mentor, they're also supposed to be in the classroom to have diagnosis and therapeutics, which is also 3 different semesters with 3 credits each. And in this, they learn about the theoretical part to advance the education of learning how to diagnose and treat their patients. So altogether, when the masters we call it the graduate program or PG program in India, it involves 48 credits to become a nurse practitioner, and the total number of credits is different depending on the different programs that you are involved in. So I also want to talk about the DNP, the Doctorate in Nursing Practice, and what is the difference. The Doctorate in Nursing Practice has become very favorite of nurses, and we are leading towards that program, which is the Doctorate or DNP. It is designed to nurses who seek to get a terminal degree in nursing practice. And that is because in 2018, the National Organization of Nurse Practitioner Faculty committed to move all the entry levels of nurse practitioner to that terminal degree by 2025. As many other programs in United States are going into the doctoral level, nursing or nurses have also decided to have their doctoral level and include all the nurse practitioners to take them when they graduate to their terminal degree. And this is important because as the healthcare delivery system is growing and becoming more complex, this vigorous education of the nurse practitioners will be needed to lead and deliver quality care to their patient. So DNP offers an alternative to research-focused doctoral programs in nursing. DNP prepared nurses are equipped to implement the science developed by nurse researchers and implement them into practice. So US trends in primary care. Studies have shown that primary care is positively correlated to the overall health of the patient. American Medical Association predicts that primary care physician, there will be a shortage, and that is why the nurse practitioner will come in and bloom in this role. This is the same that is existing in India. This slide also shows you how the medical school graduates in 2018, how they were only able to graduate in 2,730 medical schools, while in 2017, more than 22,500 nurse practitioners graduated in the primary care programs and were able to enter the primary care field to help in the healthcare society. So,
excuse me, ma'am.
Yes.
Excuse me, ma'am. We need to speed up now. We have short of
they are able to practice as full-time nurse practitioners with their medication. Do we need nurse practitioners in India? You will see the data that I've given here. This data tells you that only 15% are working in their full practice in that urban area. So we need them in the rural areas to practice. So NPs can bridge the gap. The allopathic doctor population in India is this, and that is why we need to have more nurse practitioner programs in India. sorry I took a little more time, but I'm going to tell you the nurses do rock and we need to implement this program in India. I think I am done. I'm sorry, I had to speed up the slides. So I thank you for giving me this opportunity to speak. I'm sorry about the time that I took, but really appreciate giving me this opportunity to speak to all of you. So thank you.
Thank you so much, ma'am, for giving us valuable insight about the topic Advanced Nurse Practitioner Program from USA. Thank you so much, ma'am. So with this, we'll go ahead with the question answer session. So I'd like to invite Ms. Poonam Thakur, NTA from NTA. Over to you, ma'am.
Hello, everyone. First, I would like to thank Dr. Anna George, ma'am, for this valuable information regarding advanced nurse practitioner courses in US. And as she has enlightened about the courses details also, and we are having queries also. One thing I must say that asking questions is one of the best way to grow ever. If we want to grow, we should have some queries and queries must be answered. So all the queries are welcomed over here. Without taking more time, I would like to ask the questions with ma'am. Ma'am, can we start?
Sure.
Okay. The very first query from Miss Yasmin is there. What is the way to enroll for NP program in India?
That's a very good question, but I don't know if I'm the right person to answer that question.
Yeah, actually, I just wanted to tell to all the attendees as well that our first session was the advanced nurse practitioner courses in India, but due to the unified time, we have taken the second session first. That was the advanced nurse practitioner courses in US. So I would like to take another question from your side, ma'am. In USA.
Any of the colleges, most of the colleges that have the nurse practitioner program, he can apply. And once he's admitted to the college, how to get to United States is a different story. I would not be able to talk on that, but once he's applied with his credentials and he applies directly to the college, and once he gets in, then he has to figure out how to all with visa and all. I'm not sure how to do that, but any colleges with his credentials, he can apply. And because he already has a master's degree, probably he won't have to take the first few courses that are required, which probably he already has from India.
Thank you so much, ma'am, for your answer. And 2 or 3 questions are there that are related to India only, because most of the candidates just wanted to ask how we can enroll in India. So I would like to take these questions in the next session. Thank you very much from the bottom of our heart to Anna George, ma'am, for your valuable time and valuable information. Have a great time, ma'am.
Thank you very much. Very happy to be there and meet all the dignitaries. Very happy to be in this section. Thank you all.
I would like to over the session to Ms. Jyotisha, ma'am, for continue forward.
Thank you so much, ma'am. So without wasting much time, let's move forward toward our second speaker of the day. That is Dr. Sj Nalini. She is working as a professor and principal of Sri Ramachandra Faculty of Nursing and Sri Ramachandra Institute of Higher Education and Research. She served in various positions in both clinical and teaching institute. She is a member of editorial board of Journal of Advanced Nursing and Journal of Clinical Nursing. She also served as an editorial board member and reviewer of Nursing Journal. And ma'am will be talking about Advanced Nurse Practitioner Program in India. Over to you, ma'am.
Yeah. Am I audible?
Yes, ma'am, you are audible.
Yeah. Yes. Good evening, one and all. I bring the warm greetings to each one of you from Sri Ramachandra Institute of Higher Education and Research. I am very, very grateful to the Society of Cardiac Nurses and the Teachers Association of India for inviting me over here to share my ideas related to the advanced nursing practice to paving way forward in India. Thank you, Dr. Gopi Chandran, for personally inviting me over for to be the speaker for the day. I really appreciate the thoughts that were shared by my previous speakers, Dr. Radhi ma'am, Dr. Annapurna Mary, who was very clear-cut in telling how to move forward, and Dr. Anna George for giving us a thought-provoking idea of how it goes on in US and how much they are wanted in US. Moving on to India as such. Now, you know, in India, we have a biggest challenge of caring for 1 billion of people. India being the second populous country in the whole global arena, you can find the death rates have declined and the birth rates have increased. And this has put a large amount of pressure on the healthcare system because of the high population we have. Not only that, the population is also found more in the rural area than in the urban area. And slowly we also recognize that the urbanization is indeed increasing, which will in few years to come, which will make more of urban population, which is going to be on the rise. Again, you can see the amount of disease burden over in our country, where you find non-communicable diseases are on the rise. Probably these 2 years, we found a difference here with COVID taking up and becoming the first in the race, something which we did not even expect till date. Now, this is how the disease burden grows on and put pressure on the healthcare system in India. Now, if you see the healthcare demand and supply, even though India has lots of hospitals, lots of clinics, and India has lots of dispensaries, all of these things are there, but yet we are not able to meet the supply. The reason is again the population. You find that the concentration of healthcare is more on the urban region rather than on the rural region, where you require 90% of the patients who require more of primary and secondary care, but our concentration is more on the tertiary care, particularly in the urban area. Again, the amount that the government spends on the healthcare system is minimal and lesser than what WHO in fact says. It's just about more than just about 5% of gross domestic product is being spent by our Indian government. Again, you find the facilities, especially the infrastructural facilities and the manpower facilities, the medications, everything is lesser in demand rather than the supply that is being given to the hospitals as such. Now, this is also another scenario which tells us that we are lesser in giving the amount of physicians and nurses which are in fact the need. India has just 2 nurses and 0.7 physicians in the urban area where the concentration is higher. And this is as per the statistics that is given by WHO in the year 2016. Again, you can see that the functional primary health centers are less compared to the targets that we have set. Similarly, also the community health centers, you can find it as lesser than the targets that has been set, and the sub-centers are lesser. So this shows that the infrastructure is really having a shortfall in India. Now, these are in fact the challenges that we see. The growing population is very, very fast. There are diseases that is emerging, some diseases, non-communicable diseases that is coming up in the forefront. And we have a multi-layered healthcare system that is required in hilly areas, tribal regions, rural area, suburban and urban areas. And we have lots of infrastructure deficiencies. There is scarcity of manpower over there, whether it is nurses or doctors, and the expenditure on the health is low, and there is inaccessibility to healthcare, especially from the rural areas as such. Now, this has put pressure on India. There's a transformation that is required, and indeed an answer to this is Nurse Practitioner Program in India, which is why we are here to discuss and talk and explore further and further on this topic. Now, it is always said that better late than never. So at least we should be happy that we have at least started this program. I still remember the words of Gopi Chandran and Dr. Annapurna, who rightly said in 2002, when we had the first conference in Ramchandra with our partners in Wisconsin, we were in fact discussing about family health practitioners, and we also brought in a system of curriculum which was sent forward to Indian Nursing Council, but probably nobody thought about that in those days. But here, after 20 years, we have thought about it. So better late than never is the answer that we have given. So let us move forward with whatever we have taken up today. So these are going to be the brief objectives. I'm not going to go to in detail with this. I'm just going to share the rest of the slides. Now, the Institute of Medicine has put up certain quality areas in which the healthcare should focus. Now, we as healthcare professionals should concentrate on giving a safe healthcare, a timely healthcare which is more evidence-based in nature, efficient healthcare which is given by efficient healthcare providers who are capable of giving or providing care to the patients, and equitable healthcare without any differences between poor or rich. Equitable healthcare is mandated, and patient-centered care where every patient is being respected. This is what is needed in taking up the quality components of healthcare as such. And here as nurses, we have a critical contribution to pave way so that we are able to satisfy the demand of today to provide a safe quality patient-centered again, for leading lasting change, there are 5 parameters that are very, very essential. First is inspiration. We need inspiration for the program to continue and move on. And the inspiration should come up from our own family members, that's nurses, and the government, and all the other management and the hospitals as such. The infrastructure that is required for education and practice is highly essential. And then the system of education, as already given in detail by Dr. She's competency-based, research-based, and evidence-based. And finally, you need evidence which shows that your program is really reaping benefits or not. If this I2 and E2 is there, then we are going to get a leaping benefits with our NP programs also. So who is a nurse practitioner? I think everybody has told this again and again. They are actually masters or doctoral programs level people who can take up the primary, acute, and chronic care, and also take up specialty care as such. Again, you can see that what is more important for a nurse practitioner is the attitude, the compassion to care for people, being skillful, competent, and care that is more cost effective in nature. All these are important components that a nurse practitioner should satisfy. Now we have to justify why is that nurse task shifting that has to take place. Again, you also find the nurses and midwives. They are the largest sector of people. And here you have the World Health Assembly also stating that nurses' role is very, very important, especially in the primary care settings. And in fact, the nurse practitioner role is one answer in order to meet the healthcare challenges so that they are able to deliver quality health services and also accomplish the sustainable goals of the country, which is most important today as per national health policy. Now, evidence also says the NPs has been successful in other countries. Even Dr. Anna has pointed out how much they are in demand in US. Now you can see that 70 countries have already implemented this NP program, and you can also find like South Korea, Singapore, and Thailand has been in the forefront, and many of them they are able to manage as primary care, and they're able to substitute the physicians in their country, and their care what they give has provided better health outcomes, and patients also felt higher satisfaction with the care that was given by the NPs. So the need for NPs is in fact growing, And you can see the growth of NPs is in fact growing about 3 to 9 times it has grown in other countries. And about 67 to 93% of curative care is in fact given by the NPs. And the cost effectiveness, you can see 29% of cost effectiveness is there when the NPs provide primary care, and it is about 11 to 8% in case of inpatient care. So this is what is going on. And if you see the scenario today in our country, the initiation of nurse practitioner and critical care program has been implemented in India from the year 2017. In fact, the Indian Nursing Council has gone in with an MOU with University of Austin College of Nursing in the year April 2018, and they had invited 2 faculties so that they will be able to guide us in the implementation program. And this PG program, postgraduate program, is a clinical oriented program, a residency program, which is having a component of 20% of theory and 80% of clinical practice. And the entry level, as I saw the question, anybody who's an RN graduate, who's a nurse graduate, BSc nursing, or BSc post basic nursing can take up this program with minimum 1 year of clinical experience. And if you are experienced in ICUs, you will be given the first choice as such. And it's mandatory. Anybody who wants to take up this NPCC program, they should have a parent tertiary care, which is having at least more than 500 beds and about 40 to 50 beds in multi-ICUs, which includes neonatal ICUs, pediatric, adult ICUs should be there. And the syllabus and regulations has been released in the year 2016 by Indian Nursing Council. And as of now, there are about 31 institutions in our country giving NPCC programs. And you can see the list that is available in the council website. And there are about 2 government institutions giving this program, and private organizations 29 in number. And the qualification, at the end of the qualification, you do get a registration as an additional qualification like any other MSc graduate gets it. Now, what are the functions? Now, the function varies actually in the US based on the legislative autonomy. And as such, in India, we have not been given the legislative autonomy as such. Again and again, NPCC graduate really goes in to provide her function beyond a nurse. What a normal nurse does, she does beyond that. And she doesn't have a prescriptive authority on her own, but she can follow the standing orders or the institutional protocols in giving the drugs and which is being practiced in our setup, provided there are standing protocols that are there. And she also helps in patient selections, admission, identification of problems, assessment of the problems, administration of drugs, and selection devices, therapies, what has to be given to them, and the outcomes evaluation, recognition of complications and managing them, even the adverse reactions, and administrative services. Now, these are certain things that are being put forth as the functions of NPCC nurses as such. Now, moving on to the next component of independent practice that is flourishing in our country today is the midwifery program. We call it as IMP, Independent Midwifery Practitioner. This was in fact started way before in the year 2002 by government of West Bengal was the first to initiate this program, but then it did not start off well. Then it was government of Gujarat who initiated this as a post-basic diploma program, and now this NMP has come forth from the year 2009. This is in fact a program which is 18 months, which is offered to diploma and graduate nurses. And the syllabus has already been posted by Indian Nursing Council in February 2021. And the scope of practice as guidelines has already been put up also. The title that you get when you complete this program is Nurse Practitioner in Midwifery Post-Basic Diploma Program. And this program concentrates on making you more skilled in level and par with the International Confederation of Midwives competencies. You become knowledgeable and you're able to provide skilled, compassionate, and respectful women-centered care to the mothers who are in need. And you are able to provide primary care through the midwife-led care units. And today in our country, there are about 11 institutions, and you can see many government organizations are offering the program, and one private institution which is there in Hyderabad offering this program for nurses in India. Now, what are the functions? Apart from giving the midwifery-led care, they also concentrate on Simona care under the obstetrician supervision. They provide normalcy in all aspects of midwifery as such, pregnancy, labor, birth. They give preventive care, detection of complications, emergency measures, they take it up and refer and facilitate people to go in for surgical and medical care as such. Now, there's a lot of question and debate that goes on in India. Should midwifery be practiced alone or should it be along with the nursing role? Is direct entry of midwifery like something like BSc midwifery 3 years course that can be recommended as such? Again, there are mixed opinions. India being a highly populated country, many of them feel that it is not the right time to go in for a separate midwifery. We should train members who are influenced and who are capable of being a nurse and a midwife together. That is more beneficial for a country like India, which is having higher population. Probably we'll have to go with this for time being. Later, you can have this midwifery as an independent profession. Again, many people have expressed that there is a lot of obstetric domination in order for them to take up this independent midwifery practitioner, especially in the tertiary care centers. Primary care centers, everybody knows that nurse midwives are the one giving the best of care that is possible. But tertiary care, still you find a lot of medical domination, and the legal protection what the medical people get is not there for the midwifery practitioners till date. Now, these are some of the barriers that we face. We can divide that as structural, functional, and perceptual barriers. Now, the structural barriers include the government legislation is not there, we don't have regulations set there, and we don't have much of trained faculty, especially with NPCC being a new course as such, and there's a little bit of poor infrastructure. We need to have exclusive skills lab and clinical areas so that people are trained well. Again, our UG curriculum, in fact, needs to be strengthened, and today's new curriculum that has come out from Indian Nursing Council definitely answers this question by giving more importance to biomedical subjects like anatomy, physiology, pharmacology, and pathology, which is more applied in nature. Again, the scope of practice is still not visible for the NPCC practitioner, and there is no clear career pathways that have how a person who has completed NPCC has to move on. Now, this is also something missing in our country. If you see the functional aspects, again, the acceptance, role clarity, and collaboration that we have with healthcare professionals and the management of various institutional managements is definitely something which has to be addressed. Many of the managements are still not able to accept higher educational degrees in our country. And you can find that mentoring is absent and supervision is absent in most of the hospitals. Now, till now, most of the hospitals don't even have an MSc graduate taking up position. So the nurse practitioner coming up and leading the way is, still a big question mark over there. Employability in public and private sectors is again a big question. Now, every time a course is getting started in a country, the first and foremost thinking that comes to any visionary is what will happen at the end of the course for the graduates who come out. Really, we have to think about this, how they're going to get employed. Now, people say that the salary range is between 16,000 to 47,000 for the NPs currently in India. Again, there are lots of studies that are required in order to really say what is their, growth and what is their salary as such. And again, there is no clear line of authority and no prescribing authority, as I discussed before. Now, perception. There is a lot of lack of trust on the nursing capabilities. That is why we find that many of the population, doctors, they're not able to accept nurses, think that nurses have the capabilities in order to take up the advanced role. Again, you find a lot of image deficiencies with nursing, which is there. There is poor perception that they think many of the nurses just are meant for giving only the basic care, and they do not have ability to critically think and make decisions. This is the problem with our healthcare professionals as such, the acceptance that is very, very poor still now. And again, the general practitioners, they fear that if nurses do come in as nurse practitioners, then their job will have difficulty and they will go in for financial constraints. Again, the program visibility is still very, very low in our country. We need to disseminate and create awareness among all our nursing members about the advanced programs that have come up, and But with that only, the admissions in various colleges will go up. Still now we find that the admissions are very less with NPCC. Probably the way we disseminate about this program and the way we create an awareness about this program and the way we showcase the improvement with this program definitely will pave way for better admissions and better scholars to come out in the near future. Now, what are few strategies that we can take up in order to improve the program? US has taught a lesson, UK has, yeah.
Ma'am,
Krishna, I just have 2 slides to complete. I'll make it fast. So we need to have sound infrastructure.
Yes,
yeah, we need to have skill labs. And as I told you, the concentration should be on nursing curriculum. Legislation is required, and we need to train people to teach and guide the nurse practitioner. We need to have faculty capacity building programs, regular in-service programs are required, and we need to collaborate with people, whether it is medical or nursing faculty or faculty who are nurses who are working in the bedside. What you require is training, and that has to be obtained. And we can also have collaborations with abroad universities. Again, regular renewal of license is required. Found that most of the time when inspection do occur in institutions, they only look for completion of minimal requirements. We have to go beyond and think about quality indicators where an institution has to be accredited based on this quality parameters and not by the factor of minimum requirement satisfaction alone. Research is required in order to explore the scope and explore the awareness and perception of healthcare professionals about this program and how empowered this association. There is an association for NPs, and we need to make it more empowered so that they are able to lobby and help in their image building. There is one opinion study that was done, and you can find almost the score given by doctors is in fact lesser compared to the opinion given on the midwifery practitioners by the nurses and the general public as such. And you can also find that majority of the doctors and nurses, they agreed that medication capability is available for the nurses. And in fact, nurses had low opinion than doctors in taking up this consumer's acceptance as such. Now, there's also one more study where they felt that 49% of the nurse midwives, they can run their own maternity clinic. And what is required is the post in the government areas, which can positively which can help them to take up the midwifery practitioner roles as such. Now, to conclude that nurse midwifery is in fact the need of the hour. When other countries are able to do this and proceed well, we can also be able to do that. We can also face the resistance that comes up with so many sectors, but we can move forward. And what is required is defined scope of practice, licensing of the title which you get, and the cadre structure. All this is what is required. So as nurses, we cannot take a backseat. It is time for us to move forward because we are the heart of the patient care. We all should realize this, and it's time we move forward. And I just want you to ask the question, are you all ready to hold hands with the other members of the family of nursing, push you forward? So everything it starts is belief. So belief is required at the beginning of any
Advanced Nurse Practitioner Program in India, and yes, it's a need of an hour, and we'll surely move forward through this. So let's move forward to a question and answer session. Over to Poonam, ma'am.
It was valuable and informative it was. And we have got a lot having some queries related to this course, especially in case of when we get query. the first thing is clear that yes, we are having nurse practitioner courses in India as well. So she want to ask that what qualifications means, what is the eligibility criteria for enrollment in this course?
If you want to join NPCC, that's Nurse Practitioner, it's a master's program. You just should have completed your your graduation. Either it can be BSc Nursing or it can be BSc Nursing post-basic program. You should have completed. Along with that, you need to have 1 year of clinical experience. 1 year of experience is required, and preferably in critical care units. If in case you want to take a midwifery practitioner program, you can be a diploma nurse or you can be a graduate nurse. You have to undergo this 18 months program. That's it. But what degree you get is post-basic diploma program, and you call yourself as independent midwifery practitioner.
Yes, ma'am. Next query we are having from Dr. Chongtam Pinky. Are there any chances to procure certification on advanced nurse practitioner, like we do have certification in community health officer in community?
Yeah, there are lots of certification programs that is given, offered, but those programs has to be duly recognized by Indian Nursing Council. So any program that you get additionally from your hospitals, which are not university-based programs, those are hospital-based programs, that certification adds value to your work. That's it. But if you really want to get an educational qualification, you need to go in for those recognized degrees that is given by Indian Nursing Council, which has been accepted and recognized.
Next query is from Ms. Anushka Kumari. Can you please specify the list of colleges or how we can come to know that which college is offering this program in India?
Okay. To tell you, you can just log on to the website of Indian Nursing Council. You can see the list of colleges who have gotten sanction for the year 2021 to conduct this course. And as I told you, the number of institutions that has been approved. So just log on to the website of Indian Nursing Council. You can find state-wise the name of the college and whether it's a government college or a private college, and the number of seats that has been allotted to the college is very clearly given. Or you can even, based on the the list that is there, you can contact the you can log on once again to Google, go to the college names, and you can get further information from the respective colleges. So this will help you to track how the colleges are, and you can also network with so many people, your friends who are doing so many courses in other areas, to understand whether these programs are well run in those units, and then you can take up your admission in those colleges.
Yes, ma'am. It's much appropriate to search over the INC website. I think that is the most authenticated site to visit for such kind. Next query we are having from Ms. Kajal. What is the difference between nurse practitioner and advanced nurse practitioner? Are both same or any postgraduate program differentiation between these two?
Poonam, just come again, Poonam.
Yes, ma'am. Is there any difference between nurse practitioner course and advanced nurse practitioner course?
Okay. Today, we call an NP as an advanced nurse practitioner. We had MSc programs before in our country, but this MSc programs had lots of concentration on the theoretical aspects rather than practice aspects. There's a big question also going on: what will happen to these people who have completed MSc in nursing so far? But we have to see to that these people, the present MSc graduates, may not have that much of practice component which the advanced practice roles are able to satisfy. So this advanced practitioner roles can be NPCC program or the midwifery program. It can be anything. These are all specialty programs that is offered by Indian Nursing Council so that you become an expert. These are what you call it as advanced nursing practitioner courses.
So, ma'am, currently, do we have any post as nurse practitioner in India?
Yeah, there are posts that are available. The course is there. That's what I told you. We need to still explore. There are nurse practitioners who have completed from Manipal. It's just about 2 years old. 2017 only they started, and 2019 the first batch of graduates have come out, and hardly there were a few institutions who came up, and it was very less amount of students. I remember in Manipal it was 2, and in Savita in 2018 they just started and it was 2 in number. Later on other colleges have started. We still don't know what has happened to these students. I know that few students have taken up the position of educators in their own college, as far as I know. Till today, we don't have a specific nurse practitioner role that has been given in the private or public sector for them. They have been absorbed in the hospital, but the title as such has not come up. There is no advertisement as nurse practitioner wanted in this college till now, or hospital as such.
Yes, ma'am. Next, we are having that, like we are having nurse practitioner program in midwifery. So the same, do we have any nurse practitioner program in the area of mental health nursing?
There are post-basic diploma programs that is offered. 1-year post-basic diploma programs are offered. There's a big list of programs that is available in INC website. But normally the nurses don't take up this program. There's less takers as such for this programs because probably the awareness is less. Now it is time that you can just go on, log into the website of Indian Nursing Council and see those programs. There is a program that is available for psychiatric mental health professionals also, but you don't call yourself as independent mental health practitioner as such. It is only a post-basic diploma program title that you get.
Next query from Mr. Sushil again, that if someone has post-graduated in mental health nursing, so can he pursue the nurse practitioner program in critical care?
You can. It's a different degree you are taking up. You are already an expert in psychiatric or mental health nursing. If you want to take up, you are starting from first. There is no bridge course or something like, what you call it as an additional course you can waive off. Here, it is not yet started as such. Probably Indian Nursing Council has to think about this dual degrees and certain waive off that can be given for people, because these are people who have completed already research and they have done dissertation. Probably when you take up courses or programs, if you are interested in critical care and if you go in for a second degree, probably you should be given little bit of leverage in removing the components of leadership and research. Probably INC will definitely think about this, because now we understand that there are people like this, even who are ready and willing to take up practitioner programs in the future in their career.
One most vital query of this session related to this session is, can nurse practitioners after doing NPC course, whether they are allowed to do practice, do private practice in India?
That is what, still, as I said again and again, you are still not bounded with legislation. Okay, and as a nurse, you cannot practice still. I don't know how many of you are aware of it. There's nothing called as Nurse Practice Act. It's not there for you. We practice and we are protected and bounded only by the medical profession as such. We don't have practice as a nurse. You still don't have that legislation to guide you and help you and protect you. It's not there. And as a nurse practitioner till date, you don't have legal protection that is there for you to independently practice. Till now, you're still following the orders, or you collaborate with the physicians and then you give care. You cannot, not legally protected to go in for independent practice. That is of day to day. Things may change. Everything has a future. We have to keep our fingers crossed, and how we take it forward is what
become a pilot, how to make that happen, legislation. So in order to have a legislation, we need to have accredited program. We do not have accredited program yet. We have approved program. We need to have accredited program. We need to have all those ducks in row. Therefore, we can have a legislation. So legislation should be the talk. once we have a legislation, then we can practice. It will take some time, but it is possible. First, we can do some, MOU with some universities who are having nurse practitioner program, and our nursing council can borrow some of those courses, and our students can take courses from there, and they can guide us and get the accreditation. That accreditation, a nursing council has to approve that in order to do that piloting. And then we can develop a prototype, then legislate, then implement. So it takes a process.
Yes, ma'am. Absolutely fine. The things have been started in India and we should be happy for that. But if we want to do independent practice, so first we have to prove something, and things started roll down, and one day definitely we will be having this
Yes.
prescription also, so that we can open our own maternity homes, and we can do independent practice as well. But before getting things done, we have to put our efforts, and that is what the need of this are actually.
Yeah.
So let's hope for the best. Already we have started. And the last query of today's session: how nurse practitioners can maintain their clinical competence? Is there any licensing system or credit system NPs need to get in India?
As far as can I? Somebody willing to take up?
Please, madam. Please, madam. Just continue.
As far as the rules and regulations of all the state nursing councils, there's no separate protocol that has been put forth. In Tamil Nadu, if you see, every nurse who has completed has to go in for renewal of a license with 150 credit points using their continuing education courses. That is what is available till date. I think it will apply to many states in our country. So as far as now, that is the one which is applicable. There's no additional renewal system as writing exams or proving their competence by OSCE system. Nothing of that sort is yet available. We should think that we are just in a neonatal stage. We are just in the beginning stage. So it will take some time for us to keep and touch the levels of Western countries.
Yes, ma'am. So we are done with today's queries. Thank you so much, Dr. Sj Nalini ma'am, for a valuable time and for a better explanation. And I would like to extend my heartfelt thanks to Dr. Annapurna ma'am for adding the information more and more. And I hope we have cleared with all the queries those our attendees had. So as all of us know that nurse practitioner is the postgraduate program. Duration is 2 years. Eligibility, those who are postgraduate in nursing with minimum clinical experience of 1 year, and most preferably in clinical area, they can go for that. If you want to enroll for this course, you can search the INC website. All the affiliated colleges in the different states you can find over there. And now, without taking more time, I would like to hand over the mic to Miss Dainy Thomas ma'am to propose vote of thanks for today's sessions.
Good evening, everyone. Gratitude is the fairest blossom which springs from the soul. I am privileged to propose the vote of thanks today as the General Secretary of SOCN. Firstly, I would like to thank the guests of honor of the day for joining us. Thank you, Dr. Radhi Balachandran and Dr. Annapurna for gracing the occasion. I would like to express my heartfelt gratitude to the eminent speakers of the day, Dr. Sj Nalini and Dr. Anna George, who we owe our special thanks to Dr. Gopi Chandran and Mr. Neeraj for briefing about SOCN and explaining the vision of SOCN. A special thanks to Dr. Farooq Khan from the Nursing Teachers Association of India for the introduction about NTA. I express my sincere thanks to Dr. Maria and Ms. Jyotishana for coordinating this program very well. A special thanks to Ms. Poonam Thakur for taking up the Q&A session. Last but not the least, I would like to thank all the participants in a very special manner for joining us. Without you, this webinar wouldn't have been a success. By chance, if I have missed anyone to owe my gratitude, I extend a big thanks from the depth of my heart. I hand over the mic to Pradikya ma'am for the final word. Thank you, everyone.
Hello, everyone. So I'm Pratigya. I am from CBS Publishers. And we are honored to be a part of such a progressive initiative taken by SOCN and with the aim to, hello. I would also like to thank our speakers and our guest of honor for today for joining us and making this program a huge success. I would also like to thank our audience. I would also like to thank our audience for joining us and making this webinar so interactive. So a little bit of introduction about CBS. So at CBS, we believe in taking new initiatives. So our first initiative is Nursing Knowledge Tree, where we have published quality nursing books authored by topmost faculties and institutes. Second would be Nursing Next Live, which is the next level of nursing education and provides the platform for quality education in various forms. Last but not the least, we have Nursing Next Social, which is India's first knowledge sharing networking platform to connect all faculties and to provide them with webinars, journals, and opportunity to become reviewer and contributor with us. So thank you so much all for joining this webinar.
Thank you, Madam, Nalini Madam, Annapurna, Thank you very much. It's Neeraj. Thank you.